What's going on, guys? Dr. Andrew Wildman here, back with another video. Here today to talk about the 5 things you need to know before you go into D3, and really the 5 things I wish I knew myself, okay? So for those of you watching, if you're a dental student, if you're not, if you're planning to become one, the transition from D2 to D3 is the biggest change you have in dental school. And essentially, you go from just being a student, taking exams, to now you're running kind of like your own mini little practice. So it gets real, and here are 5 ways that you can set yourself up for success. The first thing you need to know is master your clinical requirements. So as soon as you get your clinical requirements during your orientation or after, you need to print it out, put it on your wall, and you need to know it like the back of your hand. Every day in the morning when you wake up, you should be looking at that list and checking off the things that you complete, okay? Now, to make this most effective, once you get your patients, and every school is different. Some of you guys are going to be getting patients given to you, while others, you have to go out and get your own patients. But either way, as soon as you get the patient, you bring them in for that first visit or first 2 to 3 visits, and you complete a treatment plan, you need to take that treatment plan and cross-reference it with your requirements. So you need to be saying to yourself, okay, I have patient A here, this one needs a denture, patient B needs 2 crowns, patient C needs et cetera, and then take those, treatment plan procedures and cross-reference them to your requirements. Oh, I can use this person to do my class 2 composite competency. I'm gonna use this person for, crown prep. This person needs an SRP. So you need to go to that checklist of requirements and start to not only mark off what patient's gonna, have it completed, but an estimated date as well, okay? So that's gonna be very important, and you need to see it kind of like the patients are the puzzle pieces, and the puzzle that you're trying to complete is your dental degree, okay? So once you have all the pieces in place, congrats, you are now a dentist, all right? Next step, building rapport and patient communication, okay? So this is not just important for dental school, but this is gonna be the foundation that you have when you go out to practice, okay? The way you talk to your patients, the way that you lead them, establish yourself as an authority, and most importantly, build trust, okay? This is super important, all right? You're gonna have some of your classmates who do terrible at this, and their patients don't show up. They, get complaints from the patient, et cetera, all right? So what you need to do is on that first visit, get your patient there, sit them down and say, look, John, thank you so much for coming to this appointment. It means so much to me. Now that I have your time, it's my responsibility to give you the best care. Please let me know what I can do to make you comfortable. I'm here to respect your time, and I hope that you please respect mine. We're gonna work together to get what you need done. Okay, does that sound good to you? All right, cool. All right, so build that rapport, and they're gonna become your biggest cheerleaders, all right? Your patients are gonna be people that are rooting for you, and they really, most of them love the idea that they're helping you graduate, okay? So build that rapport, build that trust, and it'll pay you. All right, so another thing here, and this is probably one of the more important things, you need to know your procedures in and out. And I'm not just talking about like being able to regurgitate things in a textbook, like literally being able to know the procedure so well that you can explain it to a 5-year-old. And you need to see your patient as that 5-year-old, right? Because all this dental jargon and being, smart and using all these, terms is just gonna turn your patient off, okay? So you need to know the denture steps, right? You need to know root canal steps, okay? Look, we're gonna bring you in, okay? You have a cavity here. All I'm gonna do is clean it out, clean out the canal, which is where, all the nerves and blood supply are. I'm just gonna make everything clean, and we're gonna fill it up and put a helmet on it, okay? A crown is like a helmet, things like that, all right? And I'll do more videos on how to actually communicate, but you need to know the procedures. And what I would recommend you to do is to go over to Dental Minute by Dr. Cutbirth. He has a YouTube channel, highly recommend it. You're gonna be able to see all the procedures on here. The first video you should be looking at is, it's titled Painless and Profound Anesthesia with the Mandibular Block, okay? The mandibular IN block is probably, one of the most complicated ways to get a patient numb, and it's also one of the most painful. So if you're able to do this painlessly and get them very numb, your patients are gonna love you, not just in dental school, but from here on out, right? I get patients referred to me just for this simple thing alone, okay? So watch the video, know it, study it well, know what you're doing, all right? You don't wanna be in there holding a needle and unsure, okay? You wanna visually see these things that you're being taught in school, okay? Now, the next thing here is you gotta know that this is a chess game, right? Your D3 and D4 year, unfortunately, it's really a political game. You have faculty, some of them, are kind of burnt out dentists who don't even want to be there. They don't even like dentistry. They're just there to get a check, get a pension. They weren't not able to have success out in private practice. So, a lot of these people are moody. They're hard to deal with. Now, don't get me wrong. There's going to be great faculties who really love you guys and are there to help. These are the ones that, you're gonna know just off gate. But the ones that are tough, right? Really spend time to try to crack that hard shell that they have. Get to know them. When they try to get under your skin, kill them with kindness. Don't show frustration. Show them that you know your procedures. Show them that you take what you do seriously, that you take this profession seriously. Carry yourself with dignity and respect. And you will find that every one of them will, with time, respect what you do, and they'll try to help you, okay? And what's even more important than that is build relationships with upperclassmen, okay? You're here to learn, okay? And your upperclassmen are a great resource. They know what you're doing. They know the faculty that you're dealing with. So you're gonna have downtime in the clinic. Try to go out and just maybe assist one of them. Hey, I see you're doing a root canal. Do you need an assistant? Suction for them, help them clean up, get their instruments. Not only are you gonna build a relationship with them, but you're gonna be seeing the procedures in real time. You're gonna be seeing all the mistakes they're making, all the hard things that they're having to deal with, and you're gonna be able to just kind of like cheat code by learning off their mistakes. All right, so get in there, find upperclassmen, and in the best cases, they'll pass down patients to you. You know what I mean? So that's that, okay? Now, if you're able to do all that, you're gonna be set up for success, okay? And you're gonna be saying, Dr. Wildman, I am killing it. I am basically about to graduate 6 months ahead of schedule. Now what, okay? So the whole goal of getting these requirements done early is you need time to prepare for the real world after dental school. And this is what most dental students don't do. They just are going with the flow. Oh yeah, when it's time to think about residency, everyone's trying to like figure out where they want to go and where they want to match to. But you need to be doing this like 2 years ahead of time. You need to be looking at the dental landscape. Do you want to do private practice? What kind of life do you want? Are you someone that, you're going to get married and have kids right away? Where do you want to move to? What jobs are out here? How much can you earn, right? What skills should you be learning while you're in dental school so you can come out earning twice as much as your classmates? You get what I'm saying? I've only been practicing for 3 years, and in my second year of practicing, I was making $420,000, twice, 3 times as much as some of my colleagues, right? So get a mentor, really study these things. And if you guys don't have a mentor or you like kind of what you're seeing here, just join my free school community. It's completely free, and my gift to you for joining is you have unlimited access to me. Ask me any questions, messages, I'll get back to you. Can't promise it'll always be that way, but for now, I really appreciate you guys who are early and helping me build this community. So I'll do my best to set you guys up for success and any way I can help. Thanks for watching, and I'll see you in the next video. Peace.